Namaskar, my name is Vivek Sharma and you are watching me from Year End Review in Lung Cancer, that's conference that is happening in Mumbai, and with me is Dr. Nishita Shetty. She has come from Bangalore and she is a medical oncologist. Dr. Saab, namaskar and
Namaste.
Very warm welcome to you.
Thank you.
So here we are talking about the session updates, what is happening in this conference, and you had a very interesting I guess session. Why don't you speak about that?
Yeah, so my session was on geriatrics in lung cancer. So I think it's very important because as we age, we see more patients with cancer, and lung cancer is drastically increasing in the elderly population. So I spoke on a comprehensive geriatric assessment on lung cancer. So whenever we see an old patient, we cannot just tell them that we can't give you anything just because of your increasing age. And routine clinical assessment won't tell us the exact physiological age of the patient.
Okay.
So a comprehensive geriatric assessment takes 1 hour to do, but at the end of it, it is worth it because it will tell us on the whole if that particular elderly patient is able to take chemotherapy, targeted therapy or immunotherapy or not. If the patient is very, very weak at the end of comprehensive geriatric assessment, and in case if the patient has got a stage 4 lung cancer, we tell the patient and the patient bystanders that not doing is the best thing for him. Less is more.
Right.
Not doing anything is the best thing what we can do for him. So that was the whole idea of doing a comprehensive geriatric assessment. Not many oncologists still do it because it's very time consuming.
Yep.
But I think there is an effort made here to have guidelines for Indian patients, some quicker guidelines, and form a data on that. So that was the whole idea.
Fantastic. So what do you cover in this comprehensive assessment?
Everything it's a wholesome thing. It covers from the functional capacity of the patient, the drugs what he's taking, because many of the elderly patients would be more than 5 drugs, that is called as polypharmacy, and their physical activity, a simple thing, how much time does it take for them to get up, walk and go, and nutritional status, cognition, depression scale. So these are the factors which are covered.
That's awesome. Doctor, there's one very important factor to the older population that when they come to India, like in Western world, how Buzurg, as we call them, are treated and how they are treated here, it's very different because like here still we respect them a lot and they say that, and I mean like it's a very, do you see some cultural differences impacting the treatment?
Definitely. I think the major cultural differences here, not only for old, but it's especially for old, the relatives don't want them to know that they have cancer. Whereas in Western population, it's not like that.
Right.
We cannot treat a patient unless you counsel the patient himself. But here majority of our elderly patients, they'll be taking chemotherapy, they don't even know that they're taking chemotherapy. That is the major cultural difference. And number 2 is the care and the nutrition. In Western population, we see them with a good body mass index, but here most of our patients are frail. So giving the drugs which at the dose of the Western population would be difficult in our patients. So that is the reason, along with the titration of the geriatric assessment, we need to do dose titration also of the drugs maybe for our patients.
That's quite insightful, and I'm sure that viewers who are watching us, they would have enlightened on this topic of this aspect of cancer, lung cancer. And you had been watching me, Vivek Sharma. Thanks for joining in with Dr. Nishita Shetty from Bangalore.